It's a pleasure to speak in today's King's Speech debate on getting the NHS back on its feet. It's clear that the country is crying out for change. And we don't mean bringing back one of the architects of austerity who started 13 years of failure on his watch to try and help a Conservative Party that is out of ideas and has given up on governing. We're seeing stagnant growth, skyrocketing mortgages, crumbling schools and hospitals and a cost of living crisis. Yet the government's agenda includes no meaningful action to deal with the past 13 years of failure. Only Labour is offering true change, a decade of national renewal in order to overcome the Conservative Party's national decline, with unshakable commitments to driving economic growth, safer streets, cheaper homegrown British power, better opportunities for all, and a rejuvenated NHS. What working people deserve is a good job, a secure home and a safe community. And the cornerstone to a good life is ours and our families' health. And at the heart of that is our NHS. This example of socialism in action is the jewel of the British Crown, a proud creation of the post-war Attlee Labour government, a creation that has been pushed to breaking point by the Conservatives, as the health service is short of 125,000 staff. Patients are waiting longer than ever for operations, in A&E or for an ambulance, and NHS staff are forced to use outdated, creaking equipment, which means longer waits for patients. The answer isn't sacking healthcare workers by introducing minimum levels of service on strike days. It's clear that only Labour can rescue the NHS from the biggest crisis in its history, get it back on its feet and make it fit for the future. And we can see that already with the welcome announcement that the Conservatives are finally adopting our plan to train the doctors and nurses the NHS needs. And the Secretary of State could have included a few more of our ideas in the King's Speech, beginning with our plan to provide 2 million more appointments funded by abolishing the non-dom tax status. We would also arm NHS staff with the latest cutting-edge technology and equipment and support more care in the community so patients aren't stuck in hospital. A Labour government will ensure the NHS is there when people need it, from cradle to grave in a fairer Britain, allowing everyone to live well for longer. The King's Speech also sadly confirmed that the Conservatives have shelved the much-needed reform of the Mental Health Act, breaking their 2019 and 2017 manifesto pledges. And rightly, this absence of the Mental Health Act reform has been heavily criticised by social work and health leaders and mental health campaigners. We need a prevention-based approach where people can access mental health support in the community when they first need it, rather than wait until they reach crisis point. And that's why a Labour government would recruit 8,500 more staff to expand access to talking therapies and cut waiting times, and provide mental health support in every school and an open access mental health hub for children and young people in every community, funded by closing interest tax loopholes and charging VAT on private schools. Accessible, timely mental health care is vital to creating a healthy society. And I want to take this opportunity to give credit to Luton Council's 2040 vision, a plan to create a healthy local community in our town, to improve population well-being, to enable everyone to have a good quality of life and reach their full potential, as part of a commitment to becoming a marmot town, tackling health inequalities through action on the social factors that impact health. And that means embedding health across all policy areas. The COVID-19 pandemic further highlighted and exacerbated many health challenges and widened inequalities affecting health, such as education, housing and employment. And the government's 13 years of failure has had a substantial impact on working people's lives in Luton. It's under this Conservative government that people are struggling to afford to meet their most basic physical needs to stay warm, dry, clean and fed. And how can the UK have a healthy society when the Conservatives are failing to ensure people have the basics? People deserve the security and opportunity to get on in life, and a good job is an important part of a healthy life. But the government needs to recognise that it's failing to break down barriers that prevent people from rejoining the workforce. 1 in 7 people in England are waiting for NHS treatment. Unaffordable childcare costs are locking parents out of full-time work. The number of young people out of work due to ill health has nearly doubled in a decade, and only 1 in 10 older or disabled people have had any support to find work. But Labour will tackle the root causes of economic inactivity by driving down NHS waiting lists, reforming social security, making work pay and supporting people into good jobs across every part of the country. A secure home is essential to a healthy life, and the King's Speech does nothing to tackle the housing emergency in Luton and across the UK. There's no sign of local housing targets or the reform needed to our planning system. Homeowners face eye-watering mortgage rates. Young people are struggling to get on the housing ladder, and the dream of home ownership has been snatched away for so many stuck paying unaffordable private rents. Labour's plan for secure homes, including council housing, will put an end to the Conservatives' housing emergency. So to conclude, this is the Prime Minister's first King's Speech, and much like his predecessors, he has nothing to offer the country other than division and more of the same. Labour has a plan to rebuild Britain and our public services. We respect and understand the effort millions of people put in every day. They deserve better from politics and government, and they'll get it from the next Labour government's King's Speech.